Hi, I'm Dr. Joan Friedman. It's another Twin Tuesday. I wanted to tell people, because if you're not in the twin world, you probably have no idea that they have things like this. This is Birth Trauma Awareness Week. And it has a lot to do with how multiple births can be a very traumatic situation for many families. Not for everyone, but we all know that multiple pregnancies come with many more high risk. There's preterm birth, there's lots of conditions that might happen inside the womb. There's a possibility of a C-section. There's a good possibility of the NICU, since multiple births don't usually go, through 39 weeks. And there's a lot of stress, even before the birth, because you have a lot of appointments with doctors, you have a lot of scans, a lot of ultrasounds, making sure that the two babies are growing well. You have the risk of TAPS, the risks of TTTS, the risk of intrauterine growth retardation. There's all these concerns that you have when you're carrying two or more babies that you don't have with a singleton pregnancy. And so they're bringing to light that this is all very normal, and that a lot of people who are treating twins, treating families or parents who are having twins, don't know about what the stress and the difficulties are with a pregnancy and a birth like this. So they want to bring people into awareness, nurses, midwives, doctors, grandparents, families, to kind of know that it's very isolating, especially after the twins are born, for a lot of families to adapt to the care that two babies at the same time need. There's a sleep deprivation, there's feeding them. Oftentimes, breastfeeding doesn't happen very easily, and it's very hard to get out of the house with two babies at once, especially two crying infants that need help, and there's only one person who's capable of attending to both their needs. So it's very stressful, and I think people need to know that when they see parents or a mom out with two babies, instead of laughing and saying double trouble, I think it's so much more important to say, wow, you are really doing a wonderful job. That can't be easy. I think something like that would be so appreciated than sort of off the cuff, dismissive jokes. Also, I read an interesting article. Now they have something called paternal postnatal depression. So they're taking it not just the mom that goes through all these adjustments and how difficult it is, but that certain dads go through their same sort of adjustment to becoming a father to two babies at one time. So it's an important subject to be aware of. And I'm also going to be speaking in September at a conference called the World Congress on Pediatrics and Neonatology. And I'm actually going to give a presentation on how pregnancies with multiples is very much a difficult road, and wanting to educate people as to what they can do and as to what happens and to what help these families can find. So thank you for listening, and I'll see you next week.